So today we're going to be going over how to do the manual muscle test for the iliopsoas muscle. And to begin, we're just going to go over a little bit of anatomy. So it is comprised of two muscles, the iliacus, which has a proximal attachment to the iliac fossa, and a distal attachment to the lesser trochanter of the femur, and that is innervated by the femoral nerve. And then the psoas major muscle, it attaches proximally to the lumbar vertebrae 1 through 5, and distally to the lesser trochanter again, and that is innervated by the lumbar plexus. All right, and then a little bit about the action of this group of muscles. It is a primary hip flexor, so in an open chain activity, it's going to bring the knee up towards the body, and then for a closed chain, it's going to produce trunk flexion, so bending forward at the hip.
As for how someone might present if there is weakness in the iliopsoas, it can be seen with walking, mainly through compensations, namely the swing phase of the gait cycle. A person may compensate with ipsilateral circumduction, so using the hip abductors instead of the flexors. Could be seen with hip hiking, so lateral tilting flexion of the hip. Could be seen with a person taking a longer step length in order to use the momentum to drive the limb forward, or vaulting on the contralateral stance limb in order to provide enough clearance for the limb as it swings. Another way that the weakness can present is possibly with poor posture, such as the slouched, or also called sway back posture, or flat back posture. And that mainly presents with tight, shortened hip extensors, which therefore cause the hip flexors to become elongated and weakened as they are not at the optimal length-tension relationship. And this is just an example of the way that the plumb line should fall in normal posture compared to flat back and sway back posture. And as for possible functional limitations caused by the weakness of the iliopsoas, would be difficulty ascending stairs, possibly more fatigue due to the excessive energy expenditure used for the compensation during the gait cycles, and difficulty getting into bed or getting into a car. And now we are going to demonstrate how to manually muscle test the iliopsoas. The recommended position for testing the iliopsoas is in supine, with the leg in a slight amount of flexion and external rotation of the hip. We do that. And you want to apply the pressure opposite the line of the pull of the muscle. You want it to be gradual but not too slow, as then you'd be testing endurance and not strength. And of course, use the longest moment arm as possible to create the greatest amount of torque. All right. Are you ready, Connor?
Mm-hmm.
All right. I'll let that way go. All right. He has a 5 out of 5 because I put the maximum amount of pressure against his leg. Now, if the patient was unable to even move against gravity, I would have them lay on their side, and then perform the arc of motion now with gravity eliminated. Go ahead. And with that, we would be able to say that he has at least a 2 out of 5 in strength.